It's you, Alexa.
Awesome. So welcome everyone. Screen switch there. So I'd love to introduce Alyssa Beaven. She is a physiotherapist working in Kamloops Home Health, and she's been here since 2010. Alyssa has worked with a variety of different clients, but spent most of her career working in pulmonary rehab and then working with respiratory clients in the community. Alyssa enjoys helping clients with respiratory conditions, learning to self-manage their symptoms and increase their independence in the community. Currently, Alyssa is working with the transition team at Royal Inland Hospital in Kamloops to assist with complex discharge planning. I've had the pleasure of working with Alyssa over the years, especially in pulmonary rehab, and it's with great pleasure I pass the mic over to her and let her talk to us a bit about bronchial hygiene.
Let me just get. All right. So hopefully everyone can see my screen here. Can everyone hear me okay? Just with a thumbs up or a wave?
Yeah, you are all good.
Excellent. So as Alexa was saying, I've done a lot of work with our pulmonary rehab program, and something that a lot of people don't really enjoy, but one of my favorite things is actually bronchial hygiene. I find it so satisfying to help people clean out their lungs because you can breathe so much better. I imagine a lot of people who are here at the talk are here because they've probably either experienced this or ongoing experiencing issues with secretions. And so the talk today is going to be, if I can get there we go. Discussion of techniques and how to self-manage your respiratory secretions. So just some definitions. Secretions is just a nicer word for mucus or phlegm or that stuff that comes up out of your lungs. And another term we will be using is called atelectasis. It's where parts of the lungs, the little air sacs, will kind of close up. And usually that is because there's a mucus plug in the airways and everything behind it will kind of close up because there's no air getting in there. Okay.
Sorry.
Okay. So we'll talk about what those plugs kind of do and how we can prevent them as well. So generally speaking, bronchial hygiene involves the use of non-invasive airway clearance techniques. So nothing going into your body, like invasive would be like a breathing tube. These are non-invasive techniques designed to help mobilize and remove secretions and improve gas exchange. So oxygen and carbon dioxide coming across the tissues. Or in other words, how to get the gunk out of your lungs so you can breathe better. So indications for bronchial hygiene. So the reasons we would do this is for people who have excessive sputum production. So sputum mucus like COPD or bronchiectasis or cystic fibrosis. If you don't have a very strong cough, we want to make sure that we have techniques to mobilize those secretions. And prophylactically, so people who may not have current issues with secretions, but want to prevent. So we can do preventative bronchial hygiene. And therapeutic, so we are using it to treat things like atelectasis, so those mucus plugs, that collapse of the airways, treating COPD, or and there can be muscular deformities that make coughing ineffective, which then we need to use these techniques to help getting things moving. Goals for why we would want to do bronchial hygiene. So again, preventing accumulation of secretions, and I'll talk about more why we don't want that to accumulate. Improve the mobilization and drainage of those secretions. Promote relaxation to improve breathing. So if we have a lot of secretions, it is hard to breathe, and then it can cause issues with relaxing when it's anxiety inducing when you can't breathe properly. And improved respiratory function and improved cardiopulmonary exercise tolerance. So basically, if you can get rid of those secretions and breathe better, you'll be able to tolerate some activity and exercise better. So how do our lungs normally stay clean? So we have a few different systems that work together to keep our lungs clear. And when everything's working properly, it all just kind of goes on in the background and keeps everything clean. So it starts with our nose and our mucus and our cilia. So the cilia, the little picture there, is the little hairs that are in our airways, and they kind of just sweep constantly and they move the mucus up. So we'll talk about how those work in just a minute. So for the nose, so nose breathing versus mouth breathing. So we always ask people to kind of pay attention to how they're breathing, because it does make a difference whether you breathe through your nose or your mouth as to how it impacts your lungs. So when we nose breathe, we have a bit of an advantage in that breathing through the nose allows the air to warm up. It adds more moisture to the air, and it filters the air because we have hairs in our nose that help to filter the air. So when we breathe through our mouth, we don't necessarily get these same advantages. So when we do breathing techniques later on, I'm going to teach you a few. We're always going to be encouraging the breathing in through the nose. And then there's our mucus. So the mucus that our nose and lungs produce help to keep our respiratory tract clean, which seems kind of counterproductive to make mucus to keep things clean. But the mucus helps trap any particles we may breathe in or anything that might be in our system. And then that cilia helps move the mucus up and out to clean everything out. So it's kind of like a little magnet, and it grabs everything along its way and moves it out of the respiratory tract. And then getting into the cilia that we have. So those little hairs, there's cells that produce these little hairs, and they protect our airways by taking that mucus and sweeping it up and out of the lungs. And it brings it up to the back of your throat, and you just swallow it. You don't even notice it's happening when there's a normal amount of secretions. And I've had people ask if they're coughing up mucus, if they swallow it, if it's harmful. It's not. The stomach will just break it all down, and it just gets rid of it. So the sinus and nasal cleaning action, so the mucus or the cilia and the mucus up in here, is a good protective mechanism against infection. So if there's bacteria or viruses or things and they can get trapped and moved out of your airways, then there's less likelihood of getting sick. And like I mentioned too, if the before about mucus staying stagnant. So if the mucus becomes stagnant or begins to accumulate, it creates a really good breeding ground for bacteria. So it's a warm, moist, food-filled environment for them. So when mucus begins to slow down or stops, that bacteria and viruses can breed and can cause things like a pneumonia or sinus infections or allergy symptoms, because everything's kind of just staying in there and it's not getting flushed out. And we do know that cigarette smoke inhibits the normal movement of those hair cells, which can lead to increased secretion retention. And something that I know a lot of people have shared with me over the years, when they quit smoking, those cilia do recover. And they find that when they quit smoking, all of a sudden they seem to have a much more productive cough. It's because those cilia have woken up, they're working, and they're flushing out mucus that they haven't been doing. And so you will sometimes feel like your cough gets worse even though you've quit smoking, but usually that does settle down. So if anyone has questions about that later, we can chat about that. So keeping your lungs clean and healthy. So how do we do this? So we talked about how important it is to keep them clean. And now I'm going to tell you how we actually do it. So number one thing that we always recommend, I'm a physio, we always go for this first, is exercise. If we can move our bodies, we breathe better and everything moves better. But exercise isn't always an option for everybody who is experiencing increased secretions. So we do have other options. So deep breathing and coughing, which I'm hoping a lot of you already know, but we'll review that. Positioning, postural drainage, percussions, and for vibrations. and then some PEP and OPEP devices that I have some examples of that I will show you. So how exercise keeps your lungs clean. So immobility is a major factor contributing to retention of secretions. And I'm sure anyone here who's in the room who has been in the hospital, you've been sick, you've had a flare up, and when the physio comes to see you, they're going to make you get up and move. And it's the last thing you want to do, but we ask you to move because we know when you're upright, when you move, you breathe deeper, excuse me, and then your lungs do function better, and it helps to promote that movement of secretions and mucus. So early mobilization and frequent position changes are preventative interventions for atelectasis. So that's that term I mentioned before, where if the air isn't getting deep enough into the lungs, you will have some sections that may close up. And then you can have mucus plugs that block air. So if we can mobilize those secretions, we can open up more parts of the lungs and we can get more gas exchange. Because if you think about if a section of your lung is not open, that's less oxygen that's going to be getting into your system. Exercise also improves overall aeration and ventilation perfusion matching. So it's lots of fancy terms there, but it just means that when you're getting the air into your lungs, you're getting a good crossover of gas, O2 in, oxygen in, CO2 out. And in general, exercise improves your general fitness, self-esteem, and quality of life. So if we're moving around, we can do more for ourselves. If we're exercising, if we can have better management of our breathing, we can be more independent and take care of ourselves better. Okay. So when we exercise, walk, run, or stairs, we take deep breaths. When we take deep breaths, we force air to the base of the lungs and behind any of those secretions. And as we breathe out, the air that comes up can help lift up those secretions and out of the lower airways. And then it has many other benefits, which is why it's our first choice. So some of our other options that we have target just the secretions, whereas exercise is a whole body approach to managing the secretions, managing your health, and things like that. So that is why we go there first. But like I said, sometimes people are too unwell to be up and moving around. So we have other ways we can manage. So if we can't exercise, breathing exercises and techniques can help with mobilizing and clearing those secretions. So breathing exercises. This is the first thing. If you've been to hospital, if you've been to a pulmonary rehab program, if you've come in for any breathing condition, this is the first thing you're going to be taught. And this is the first thing we show everybody is how to do deep breathing and coughing. So we want to do nice deep breaths in through the nose, activates the diaphragm, warms the air, moisturizes the air, filters the air, gives you good deep breath. So if we breathe in through the nose, slight breath hold allows the air to really go deep into the lungs, and we breathe out through pursed lips. So pursed lips would be breathing out with your mouth partially open, and you breathe out more slowly than you breathe in for. So it would look like this, like a breath in. So notice a nice long breath out. The slightly open lips creates a little bit of back pressure, which can help keep the airways open so that that mucus has a bit more ability to move through the system. We encourage people 10 good deep breaths followed by a huff cough and a good strong cough to help mobilize secretions. So this is good when you have secretions. It's also good to do this when you don't, to help just keep things moving. I like that preventative information that I was talking about before. So I mentioned in that slide there the huff cough, and for anybody who doesn't know what that is, we'll go over that. This always makes me cough no matter what, because it does such a good job moving secretion. So I will apologize in advance. So our huff cough is a way to mobilize those secretions and cough them out that are lower down in the lungs. So a regular cough will clear kind of what's sitting right here. But when you have, and you can always feel when there's something deeper down and you can't clear it out. So sitting in a comfortable position, head slightly forward, feet on the ground. You inhale deeply through your nose again, and you're going to exhale in short but non-forceful bursts while keeping your mouth open. Similar to if you were fogging up your glasses to clean them or fogging up a window to draw a little happy face like my kids do on my car windows. So do a couple of those, and you're going to avoid a forceful expiration. If you hear a wheeze or if it's exhausting, you're going a little too hard. So I'll show you an example of what this can look like. So breath in. So it's open mouth, open throat, kind of like a huff. Like I said, always move something, even if you don't feel like there's something there. So you do a couple of those and you follow it with a stronger cough just to help cough out anything that you may have brought in or brought up. So I'll show it again. So breath in through the nose. So not forceful. Sometimes people will do shorter puffs. So a breath in like that. Doesn't have to be one long one. It kind of depends what feels right for you. Sometimes if you're in a bit of a coughing fit, if you're coughing, if you can throw in a quick huff cough, it'll sometimes just dislodge whatever it is that you're trying to clear. And I have one slide in here about coughing. A lot of people say, I know how to cough. You don't need to teach me how to cough, but a lot of people don't cough very effectively. So it ends up wearing you out. It's exhausting. You cough and cough and cough and cough. Nothing comes up and you're just tired and it hurts. You can like feel like pain in the muscles because you're coughing so hard, but you're not getting anything out of it. So sitting in a correct position, using deep breathing can help control your coughing. So the best way to think about doing it is take a breath and limit your cough to 2 good strong coughs. If you feel like you're not coughing strong enough, as the picture shows, you can have your hands on your abdomen and you can give a little bit of a squeeze to help increase the strength of your cough. So rather than going where you're just running out of gas, thinking about taking that breath in and do 2 good strong coughs and see if you can dislodge whatever you may have brought up with your huff cough. There we go. I'm going to have good clean lungs by the time I'm done here. I haven't even gotten into the other stuff yet. So positioning is one way we can use to help move secretions, especially when people aren't very mobile. So we talked about how exercise is our #1 thing. If someone is really not able to get out of bed, they're stuck in bed, they can't get up, we would then look at doing our breathing techniques. So we can do our huff cough, we can do our coughing laying in bed, but we can also use gravity to help move stuff out of the lungs. And so that's where we go into our positioning. So we use specific body positions to treat certain parts of the lungs. So positioning can help us optimize oxygen transport by improving airflow to the more open areas of the lungs. We can increase lung volumes, reduce the work of breathing, minimize work of the heart, and increase the mucociliary, so that those little hairs that move the mucus, we can emphasize how they can work a little better. So one of the things, I don't know if anyone here, they may have experienced this, is you can use postural drainage. So this is where I said we can use gravity. So we get secretions to a point where you can cough them up and out of the chest. So we can lay people in different positions to move the different parts of the lungs. Because you think about our chest is like a cylinder and there's different lobes. And so you can take that cylinder and have it this way. You can have it that way, this way. Like you can position it in different ways so that the lung portion that has the most secretions in it can be the highest up, and gravity can help things flow downwards. And I've got some examples here. So these are some examples of positions that we can use for postural drainage. So this one here, it's kind of just laying on your back, comfortable with your knees bent, but it's putting the front, can everyone see my cursor? You see my cursor on the screen? Okay. So you can see the front lower part of the lungs is at the highest point. So that's going to help drain those secretions down. So if we've listened to your lungs, or if they've done an x-ray or whatever it may be that they've assessed, and if you think that secretions are more in the front, we can lay you in this position. If we feel like your secretions are more on on one side or the other, so for this fellow here, he's laying in a way, I'm terrible with left and right, he's on his right-hand side. So his left lower lobe of his lung is in the highest point. So if you think about gravity, it will pull secretions downward from this point. So that can help if we know the left side, if so this fellow's left side may have more secretions, that's the way we're going to position him for either just position in that position for a while, or we can do treatment in that position. And then the last one here, which looks the most uncomfortable, but it is effective as well, is if you think about the back. So the back lower part of the lung is at the highest point, and then gravity can help pull that down. So if we're using positioning, we would want to be in these positions for probably about 20-30 minutes to allow that mucus to move. 2-3 minutes isn't long enough it's not like it's water, it's moving, it's a thick substance moving through small airways, so it will take time. But to speed up the process, we can do some of our therapeutic treatments in these positions. So I'm sure some people in this group have had what we call percussions. So this is where we can create some vibrations in the system to loosen that mucus to help it move through the system a little more easily. So physios will do this either in hospital. When I worked in home health, I had some clients that would get frequent flare-ups. They'd call me up. I'd go to their house 2-3 times a week. We'd do some percussions and just help get these things cleared out so that they didn't end up having to go on antibiotics, because they knew when they were going to be getting sick. And it would help just move things out. So it's a rhythmic clapping on the chest with a loose wrist and a cupped hand. So if anyone wants to try this, I can't see all of you, but if you think about if your hand is flat and you hit your other hand, it just makes a slap. If you have a cupped hand, it kind of creates a little pocket of air. And that little pocket of air is what creates that vibration. So we're not just hitting people, we're cupping our hand and creating a little pocket. Because some people can do these percussions on themselves. We will teach people how to do that. And it should make kind of a clopping sound instead of a slap. And it can help dislodge. So in this picture that you've got down here, this fellow is kind of indicating that he's doing those manual percussions kind of on himself. So if we were to do them on someone, we can do both hands. You can do just one. You can try it on yourself. You can kind of hear, I don't know if you can hear the difference between, or a bit of it has a little hollower sound. So people can sometimes get onto their back, on their chest. You can't really see. Got it on your lower ribs. But the trick again is that cupped hand, because you're not just hitting. And it's a lot more comfortable, because if I was slapping my clients, they wouldn't feel that very comfortable. But with the cupped hands and clothing in between, it's actually pretty comfortable to have someone do that. Vibrations. So these are some, we've kind of, I haven't used vibrations very much in quite a while. I know that it is commonly used for things like cystic fibrosis. So that's a condition where people have a lot of secretions and difficulty managing. That's what the little vest is here. So this is a vest that vibrates. and helps mobilize secretions. I do have an example of this little back massager. So I've used these before. That's just vibrates, makes a lot of noise. But some people do find at home they can manage with that. I would just check with, if you do want to try something like that, I would just check with your doctor. There are some conditions that we wouldn't use this for, but it is something that's out there. And I've used it on people in the hospital, say someone in ICU who can't really move, they can't really breathe very well, but we've used it to loosen secretions when we couldn't really position, we couldn't use some of those other techniques that work a little better. So it's something that's out there, but again, kind of moving away from using them, it seems like lately. Mobility, walking, exercise, always going to be our first choice. And then we have some little devices that can help. So do they, I don't know, do we still use these very much? The PEP devices, they're not really a thing anymore, are they? Because we have so much better things out there.
You can't order them anymore.
No. I remember
We have different ones, the Arabica, the ones.
Yeah. Now that we have an option that's in the pharmacies, you can just go buy them. Just for historical sake, this is a little, it's a valve from a ventilator, and it has a little bit of resistance in it. So the idea is when you blow through it, it splints your airways open and creates the ability for mucus to move through your system. So 14 years ago when I started doing this, we used these a lot and we gave them out a lot. But now we have different and better options, which I will also show you. So oscillating PEP device, so positive expiratory pressure therapy. So it's same, getting stuff caught here. Same idea as this, but it's a little fancier. I'm not sure how many people have one of these, but we do recommend them quite a bit. It's a simple little device, helps mobilize secretions to treat atelectasis or any condition where you have excessive mucus. You breathe out through this device to keep the airways open, but it also has a little valve inside. I don't know how well you can see that, and it flutters back and forth. And it vibrates kind of the inside of your lungs. So I showed you different ways you can vibrate from the outside, but this creates kind of an internal vibration, which loosens and shakes up those lungs. So helps with air trapping in asthma and COPD, mobilizes retained secretions, prevent or improve atelectasis, and can optimize delivery of bronchodilators in patients. So with your puffers. So that's something actually I haven't mentioned yet. I don't know if I have it anywhere else in here, but if you have a lot of secretions in your airways and you use your puffers, a lot of that medication may stick to the mucus rather than getting to the cells it's supposed to get to. So we often will teach people, if you have a lot of secretions, use the techniques to clear your secretions as best you can and then take your medications. They will be more effective because they can get to the cells that they're targeting. So this little device, like I said, Arabica or Aerobica, I'm not sure exactly how to pronounce it. Available at most pharmacies. I don't know what the price on them is now. Last time I looked up, they're about $80. I'm sure that's gone up, or is it about the same still?
Around Costco, they've been around the $80 mark.
Okay, about
Costco's
$80.
the cheapest, and you don't need a prescription or don't need a Costco card to go there. And they've always been the cheapest.
Yeah, so Costco pharmacy is still the cheapest to buy them. You don't need a membership. You can just go into the pharmacy. They're behind the counter. You can ask for one. Again, just double check with your primary care provider because again, there are going to be some conditions that we wouldn't use this for. So just double check that it's not, or that it would be safe to use. But what they do is you breathe out through the little mouthpiece into the device. The valve will flutter back and forth and you'll feel a shaking in your lungs. I'll breathe into this. You can kind of hear it, I think, if I'm close enough to the microphone. And then I will cough a whole bunch because it always makes me cough because it actually works. I use this when I'm sick. If I've got a cold, I use my Aerobica to help clear everything out. So again, deep breath in through the nose, deep breath, hold slightly if you can, 5-10 seconds. Not sure if you're able to hear that. Kind of a rumbling noise. No? My microphone may not be so great on here. All right, there we go. So we would recommend breathing, using it 2 to 5 times, or steps 2 to 5. I didn't number these. 4 to 5 times with this, and then a huff cough, and then a regular cough, and then some gentle breathing. The nice thing I do like about the Aerobica versus some of the other devices that are out there is if you use a nebulizer, you can connect your nebulizer to this device. So you can have your nebulizer with either just humidified air or your medication, breathe in through the device, breathe out and get the treatment of the oscillation and the vibrations. Breathe in with your medication, breathe out to get the treatment. So you can do a dual treatment, which is time saver and is more effective. So it's a nice thing about these little guys. So other bronchial hygiene tips that we've got. So staying hydrated. So your body, everything in the body works better when we're properly hydrated. Excuse me. Mucus is more fluid and easier to clear. So if you think about a loose, watery mucus versus dry, sticky mucus, obviously the loose, watery will be easier to clear through the system, easier to move, and less likely to accumulate. So drinking enough water. And then nasal rinses. I don't know if anyone uses these, good for allergies or any type of upper respiratory conditions. I don't have one of the neti pot, so this is the neti pot. This is a gravity type, and then you can get the squeeze bottle type too. I have little ones for kids, and you get little packets that can go in there of what is in these? It's basically like a sodium, kind of a salt packet with like salt and baking soda almost. You can make, there's recipes to make your own. You can buy the little Neomed ones. The idea would be fill it with the boiled and cooled water. Cooling it is important, but you don't want to just put tap water straight up into your nose. So you want to boil it, let it cool, fill up your thing, and then you will squeeze in through one nostril. It'll go up through the sinuses and out the other. Usually recommend people do it in the shower, or if you're comfortable doing it over the sink, that's fine too. Sometimes with the first couple times, shower is not a bad place to do it. And keeping your mouth open and breathing through your mouth as you do it. If you don't, you may gag and not so pleasant things happen. But keeping the airway open through your mouth is a little easier to tolerate doing that. So nasal washing, I guess I already talked about this. Cleans mucus from the nose. Medications can be more effective. So if you have nasal sprays as well, so flushing out your sinuses before using the nasal sprays can make the medication more effective, leading to not having to use it as much. Gets allergens and irritants out of the sinuses, bacteria and viruses, increases airflow. So there again, do not use tap water unless it's boiled or filtered. And thoroughly clean everything that you used, because you don't want to have it with bacteria, and then you're introducing bacteria into your system. So, and then hydration, like I said, being well hydrated loosens secretions, reduces dehydration. So making sure that drinking lots of water, but if you have certain conditions like heart failure or renal or kidney disease, you want to make sure that you're following your recommended fluid intake. Immune system is improved when you're hydrated as well. Some people find that having a humidifier, especially if you live in a drier climate, can help. But I've also found that some people with COPD find that the humidifier makes it harder to breathe, or with certain conditions. So sometimes it's just a matter of figuring out what works for you specifically. The other thing with a humidifier, you do want to make sure that I can't remember what the percentage is now, But you want to make sure you don't over humidify your home because it increases the risk of mold growths and certain things like that, which are not going to be good for your lungs either. So humidity, you want to keep it in a certain range. And I just cannot remember the numbers for that off the top of my head right now. So, but I'm sure that information is available. I don't know if Lindsay or Alexa know it, but we can look it up. So methods and choices for hydration. So we want to increase, if you feel like you're not drinking enough and you want to increase your fluid intake, just keep in mind spacing it out throughout the day. Make sure think about having extra fluids with meals and avoiding too much fluid in the evening, especially if you do find you get up to go to the bathroom quite a bit at night. Good choices: water, juice, milk, herbal tea, soups, all those things have fluids. Mindful of soups with salt, sodium, because salt can pull fluid out of your system. And same with caffeine and alcohol. They can be considered a diuretic where you will be taking in fluid, but you will lose some of that fluid more so than if you were drinking juice or herbal teas or things like that. So limiting the caffeine and the alcohol as your fluid choices for the day, ideally looking at water or other options with less sugar or salt. All right. Any questions? I know I can see there's a few things in the chat if you wanted to go there first.
I was just going to touch on, I just quickly read up lightly on the humidity. So research shows that ideal relative humidity in your home is between 40 to 60%. And to discourage growth and spread of mold, levels should be kept below 50. So 50% sounds like it's mostly the sweet spot.
Yeah. I knew there was a number. I just couldn't remember what it was.
And I just put in the chat the link to the Government of Canada. It's their recommendations, which Alyssa, like you said, it's between like 30 to 50%, 35 to 50. Anything lower, it's a little too dry. Anything higher, like Alexa said, can encourage mold growth, et cetera, et cetera.
And it's going to fluctuate with the seasons. So in the winter, we don't need as much. In the summer, we might need more if we live in those dry climates like Kamloops and in the interior. So.
There was a lot of information to digest in a hurry. Is it possible to get a copy, a set of these slides?
This recording will be posted on the BC Lung Ask the Experts website. And then I'm not sure if you're on the Better Breathers Facebook page, but I also posted on there too.
Yeah, I've got pulmonary fibrosis, so it's a tough one with that. So all that stuff about the mucus was very interesting. And so you said we could get the slides going, what site could we go to?
So BC Lung has their own YouTube page, and on their website, there's exactly where you registered. Underneath Ask the Experts, there's right underneath it says video library, and we have a library. This will probably be posted. We usually give it a couple business days, probably by Friday or Monday. But it will be posted the next couple of days on the BC Lung Association website, exactly where you would go to register. Right below it's the library.
Yeah, that would be very helpful.
Brian, we'll get to you. I want to get through the chat questions first, just so we don't forget them. There was one question, Marilyn Gerald, she said she's on a prescribed eye drop for macular degeneration. They seem to dry out her nose. She guesses this would affect her breathing, as not as much moisture in my nose. So, like Alyssa mentioned, having moisture, the body works better with moisture. You want to make sure everything's good. So Alyssa, I'll hand that to you to maybe just answer that. And Marilyn, if you want to unmute yourself and clarify, please feel free.
Yes, Marilyn here. Yeah, it's an eye drop that I use at night. And as I say, it does dry out my nose. I do use the nose rinse though. I use it possibly once or twice a week, and that seems to help. And I regularly exercise. I do aquafit 2 or 3 times a week.
Yeah, I was going to recommend the nasal rinse just to help like flush out and keep those membranes hydrated, increasing your water intake if you're not already drinking enough water. But yeah, those would be kind of the things. And if you find you're using it and it does help, you can use the rinse more often. I don't think there's anything to say you can't do it more regularly if it does help with that dryness.
Thank you so much.
And Marilyn, just to add on to the nasal rinse, like Alyssa said, you can use it essentially every night if you choose to. One of the community respiratory therapists who is a big proponent of nasal rinses suggests to use it about an hour before bedtime. Because then it gives your nose a chance to kind of get moisturized, but also if those membranes are dry and maybe a little angry, they'll be soothed and kind of moisturized before you go to bed.
That's a very good hint. Thank you so much.
Yeah, and it flushes any irritants out before you go to bed and it lays there and yeah.
Yeah, and also the giving yourself time before bed too, because you can end up with, if there's a little bit of fluid left behind, it could be dripping into the back of your throat when you go to bed. So give it a bit of time to have everything kind of flush its way out before you lay down. Otherwise, you're going to be kind of feeling that kind of cough in the back of your throat when you try to sleep. So
I generally use the eye drops right before I go to bed. So
yeah,
suggesting that I do the rinse and then carry on with the eye drops in my usual fashion.
I would. Yeah. Yeah.
Okay.
And yeah, an hour before bed, do your nose and then your eyes right before bed.
Okay, thank you very much.
And if you run out of, you can get some of the nasal rinses come with a pre-made solution. Others, like Alyssa said, it's boiled and yeah, you'll use a little packet like that. If you run out of them, you can look up a recipe to make your own salt additive, but it's not just table salt. It's too harsh for your nose. So please do not use just regular table salt like you would gargle your throat. Your nasal membranes are so much more sensitive. They need those special additives, like she said, baking soda. And I think there's a few other things that are in there as well.
I think I have about a year's supply of those little packets.
Well, there you go. It'll be perfect. Okay.
Next one was just Ted. He mentioned the wildfire protection information that some of you guys were wanting. So that's in the chat if you're wanting more information on that. Thank you, Ted.
And then Floro Fresnoza asked about using an Aquapack inline from their oxygen concentrator to keep the dryness out of your nose to breathe. In regards to anything with your oxygen therapy, please verify with your provider that you're using equipment as it's supposed to be used, and anything you're adding on is safe to add on. That's, I think, Alexa, I would defer to you in this as well.
For the Aquapack?
Yeah.
Yeah. Essentially, it's a humidifier added into the concentrator. So as long as it's not causing any issues for you, like Alyssa was mentioning, it's great to keep our airways, moistened and not dried out, so you can help get those secretions out. But as long as it's not causing the opposite signs where it's, making you cough too much or you're finding that it's bothering you, then it's great to have it in.
Can I say something?
Yeah, go ahead.
Yes, please.
I have oxygen 24/7 in the house with a long hose, and I've been on it since June 2021. And in the last 6 months or so, I've started to suffer with a very, very dry nostrils, and they get crunchy, and yeah, it's really bad. And so I thought maybe I should get a humidifier like they do in the hospital. They attach to the oxygen on the wall. And when I spoke to MedPro, the RT, she said that they're more trouble than they're worth. Now I know there's different oxygenators, but she does not recommend putting a humidifier on an oxygenator. So she didn't suit me up.
Yeah, there's different equipment at home versus in hospital. And one of the things that Alexa and I were chatting about is your oxygen tubing is not a very big inner diameter. And so droplets of water could potentially occlude it and maybe affect the level of oxygen that you're getting. And like she said, to run a humidifier off of that equipment probably would require a lot stronger equipment. It might be out of pocket. So yeah, so generally, whenever we discharge patients from hospital, if they're on humidity in hospital, we do everything we can to get them off of the humidity by the time they go home. If you are suffering from the dry nasal passages, because you are on a dry gas 24/7, of course it's going to dry those out. Like Alyssa said, staying hydrated, because we hydrate from the inside out, but you can try and get a water-based lubricant for the inside of your nose as well. So Vaseline is petroleum-based. It just sits on the top of it. It doesn't do anything to help remoisturize. But if you can find a water-based lubricant and put that in, then that can kind of be absorbed into your nasal passages and not interfere at all with your oxygen therapy.
I think NeilMed makes one, do they not?
I think so.
I think so,
Yeah.
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 You can get it at any like London Drugs or any of those types of areas.
Yeah. Yeah, because NeilMed is the company that makes a lot of the sinus rinses and the little packets and everything. So they do have a tube of a nasal lubricant that works as well.
I don't know if I should say anything, but I mean, I used to buy this, what is it, Sakara or whatever. And I was told by my respirologist, KY gel works better because it's the same thing. So here, I'm lubed up pretty good. Sorry.
It's water-based, you smarty pants.
Water-based lubricant, right?
Yeah, so
And
water-based.
Whatever
and
works.
it's half the price. It's
And
half the
and
price.
it should always be in stock. So there you go.
I did have a question that was a direct message, and it was from Brian Patterson. I see you also have your hand up. Is that to ask the same question?
Yes, same question plus one other.
Okay, I'll address the first one here. It was, does blowing up a balloon strengthen lung function? For some people, so breathing out, so blowing up a balloon would essentially be breathing out against resistance. I've never had someone training on expiratory volumes. I have had people where we've trained them to strengthen the muscles for breathing in more so than breathing out. Not necessarily with COPD. So it's not something that I personally wouldn't give it to someone as an exercise to strengthen the lungs. I would be focusing on the deep breathing through the nose, diaphragmatic breathing. So really training to breathe with your diaphragm rather than these muscles that are up here. And that pursed lip breathing and really working on getting good control of your breath out with the pursed lip breathing to help just with that little bit of pressure. But I wouldn't be telling people to do balloon blowing up or that expiratory training for these types of things. So
Okay.
does that
Second question. Thank you for that. Second question. When we talk about hydration, it's all very nice to talk to my doctor, but what's your opinion about, is there a recommended amount of hydration for a person based on body size or something like, or whatever?
There's not one amount that fits everybody. I mean, typically you hear 6 to 8 cups a day, and it really just depends. And again, the people who have to be careful that I've worked with are people with kidney disease or heart failure, where if you have a condition that makes you retain fluids, you're going to be restricted on how much you should be drinking throughout the day because you don't want to retain too much. But typically, just frequently throughout the day, just having water available, drinking. If you're thirsty, drink, right? So just making sure that you're staying on top of it. But on average, I think most people would be that 6 to 8 cups a day outside of any other medical conditions. Sometimes I've told people if they have a hard time getting that water in, to fill a jug at the beginning of the morning, have it in your fridge, so you have a visual indicator of how much you've been drinking, and make it your goal to say, if your goal is going to be 6 cups a day, fill up your 6 cups and have it your goal by the end of the day to be done. So then when you look over at your jug and you think, oh, I've been drinking lots, and you realize you've only drinking this much, you really haven't had that much that day, or just keeping in mind other things you may drink. So yeah, it's hard to say. We can't say everybody needs this much fluid, but also depends if you're sweating a lot or if you're in a hot environment and things like that. If you're sweating a lot, you're going to need to replace that more, or if you've been sick.
I thank you very much for a fantastic presentation, which is extremely useful. Thank you very much.
I think there was a couple more questions. Oh, sorry. Go ahead, Michael.
I just would like another demonstration of the aerobica, if you can do that for me.
Oh, this one?
Do you breathe in while it's in your mouth and then breathe out when your mouth is...
You can breathe in through it. There's nothing that would stop you from breathing in.
Yes.
And especially if you have your nebulizer attached to it, you would want to breathe in. And so, but breathing in isn't the treatment if you don't have a nebulizer. Breathing out is what gives you that vibration. So it's the breath in.
I don't see you.
I'm not on Spotlight anymore.
Let me see if I...
There we go.
There you go.
Can you see me now?
Yes.
So it would be just
Yes.
can turn sideways here. So the other thing you want to make sure you're doing is that you're keeping your cheeks kind of firm. You're not puffing them out or letting them flop, and then all the vibration will come through here. But yeah, you can breathe in and out through it.
About 10 times?
We usually say about 4 or 5.
Yeah.
Okay.
And then you would do a good cough, or cough when you need to. If you have to cough after 2, then absolutely you would cough after 2.
The reason I asked, because I have one and I use it usually in the morning, and I do not cough after that, but the coughing comes an hour or 2, or sometimes 3 hours after that. And if I do have mucus, good chunk of mucus comes out.
Yeah, it's not always instant, but and that's where we say people use it as a preventative, or kind of use it regularly to keep things moving. I usually recommend people use it in the morning and then take their inhalers, and then use it in the evening, clean everything out if you can before you go to bed. So it's a little, so you're not coughing all night. Yeah. There was a quick question.
Yeah, I was just gonna add, Lorna asked what level should it be set at?
Yeah, so there is a little dial. I don't know, because I've got my background blurred, it's hard to see.
You can see it.
There's a little dial there, and you can adjust it from low resistance to higher resistance. I usually tell people start at the lowest and have it set to where your breath out is probably about 8 to 10 seconds, I think. Or at least 5 or 6. So if your breath out is too fast, there's not enough resistance. So start at the lowest, and then you can work your way up as you find your breath gets a little stronger. Because if I have it on the lowest, it's too fast. So I have it on the highest setting, and I think a lot of people do end up on the highest, but it just depends on the strength of your lungs. So start at the lowest and just track how long it takes to breathe out.
Well, I have it set at 3. It's Lorna here. I have mine set at the middle, but are you supposed to hear that vibration? Is that when it's working properly?
Yeah.
And if you don't hear the vibration, then you're not breathing out hard enough?
Yeah, so if I breathe out through it, if I'm breathing too, not strong enough and just kind of lightly breathing, it barely moves. If it's not moving at all, you may have to take it apart. They do need to be cleaned and rinsed, and just make sure everything moves and everything is moving inside it.
So maybe I'm breathing out too slowly. It should be sort of forcefully, shouldn't it?
Enough force to create the vibration. You don't want to be like every muscle in your body forcing the air out, but if I'm just going to see how it feels. So there is some force, it's not just letting the air come out. You're pushing the air out.
Mhm. Okay.
Yeah. But you should definitely be hearing and feeling that vibration. It shouldn't just be, if you're not, try breathing a little bit harder. If you're still not, check to make sure that everything is moving inside and that it hasn't like jammed up on you.
Okay, thank you.
Mm-hmm.
Thank you.
I think
There's a
talking
question about
humidity makes it. Should I be using, Miriam Bolin is asking if she should use a dehumidifier as humidity makes it harder to breathe with her pulmonary fibrosis.
Again, the humidity piece is always a kind of a personal preference. And again, it sounds like humidity does make it harder. You could check to see what the I think there's little meters you can get to measure the humidity in your home. Because remember, there was that range that you're supposed to keep it within, and then seeing if adjusting adjusting the humidity levels does make it better or worse. I think some thermostats I think can check that, but I'm not sure exactly. But yeah, you can get the humidity in your home checked, and then see where it falls.
If humidity is hard and making it difficult for you to breathe, then monitor other activities that you are doing that might add humidity. I know
Showering.
Exactly. Patients that have COPD find that being in a very humid shower makes it hard to breathe. And so opening the shower curtain or the shower door, having that cool breeze on your face helps kind of calm your breathing down. So if it's activities like that that might impact them, then try and find ways to help you with it. Maybe a personal fan on your face might just cool the air down a bit, make it feel a little better. Yeah. Okay, we'll answer the last few questions and then we are out of time, my friends. So we've talked about this. How to control mouth dryness while sleeping. Well, that's our mouth breather. And so we need to close it down. And whether that be drinking water before bed, medications might make your mouth dry, not drinking enough water might make your mouth dry. But if your mouth is hanging open, there might be a few reasons for it. It could just be that you need a chin strap to keep your mouth shut. It could mean that maybe your mouth is open because there's other breathing issues going on while you're sleeping. So that's something that might take a bit more investigation, I would say. But try and see if you're a snorer.
Thank you.
You're welcome. Marilyn, you also asked about adding electrolytes to your water.
Yeah.
I'm not a dietitian. I cannot answer that, but I sure like the taste of electrolyte-rich juices.
Well,
It keeps your blood volume more, like it increases your blood volume. Like it's important to drink electrolytes to keep you hydrated.
Yeah.
Well, I've heard that in order for in order for you to completely hydrate your cells, that the electrolytes are the answer.
They're
follows salt.
absolute. Yeah.
Okay.
Yeah.
All right.
So don't drink salt, but just
no, I have the solution that ones. Yeah.
They're a great alternative to help keep you hydrated. I use them, especially if you're getting out there and becoming more active and stuff like that. They're great additives, and it helps, for me, like having electrolytes, they taste a bit better. I drink more water, keep you hydrated more.
Yeah. Thank you.
Floro, you asked, does using an oximeter measure the effectivity of any of the activity we use to improve breathing? Oh, so I think they're asking, is there a way to measure, Alyssa, if any of the breathing techniques is improving their breathing?
I mean, the pulse oximeters sometimes say, like in the hospital setting, if someone's oxygen is low and we know they have secretions, if we clear some secretions, sometimes we can get that number up, but it's not always an indicator if you have increased secretions that you will have lower oxygen. So the pulse oximeter is not always the best. Honestly, it really, and even with the pulse oximeters, we often tell people don't focus on the number, focus on how you feel, because the number doesn't always mean a whole lot. It's how you're feeling. So if you try these techniques and you find that you're breathing better, you have more energy, the secretions are easier to clear, So as you get more effective at these techniques, you'll find that you have to work less to get the secretions out. So the first few times you might find you have to work a little harder to get it, and then it becomes a little easier. The aerobica, if you're using one, it just becomes kind of routine, and there's less secretions coming up every time. But if you're doing it regularly, and it's less tiring, you won't feel so exhausted when you're clearing these secretions if you use the techniques like the huff cough and the aerobica, so that you're not just coughing and exhausting yourself. So really just the best way to measure is just how you're feeling. I don't know if you want to add anything to that, but that's kind of how we try to go.
I think that's right. I mean, you can always focus on the numbers, but everybody has a different normal. And so if you focus on trying to be exactly like your friend or your neighbor, everybody's different, and that's what makes us so great. So definitely it's how you feel, like Alyssa said. In regards to, there was a question about the aerobica through Costco. You cannot find it online. You have to go into the store to find it. And it's about $79.99 plus taxes. But like Alexa said, you do not need a Costco card, it sounds like.
You can get it at other places like London Drug, Shoppers, all these drugstores. They're just maybe a little bit more pricey. But all the drugstores are going to have most, or will likely have it.
Yeah, it's on Amazon for $84.99. So
yeah,
a $5 difference. Okay.
Okay, so we're out of time. Just want to quickly remind you, our next talk is on March 27th. So the last Wednesday of the month from 2 o'clock to 3 o'clock. And our guest speaker, most of you guys will know her, Jill Lomer. She'll be doing some activity and COPD. So once the link is up for registration, go ahead and register for that one, and we'll see you guys in a month.
Hey,
everybody, have a good day.
very much.
Thank you so much
Thank
for
you,
joining.
everyone.
Thanks, Alyssa. That was
Thank
great.
you. Have a fantastic day.
You too.